You have to nail every step along the patient journey to deliver high quality and predictable outcomes. My name is Hisham. I'm a specialist and consultant orthodontist. I've been a dentist for 15 years and practicing orthodontics since 2013. I teach orthodontics to specialty trainees and to dentists, and I have a special interest in aligners. The patient journey is really a reflection of how we treat our patients in a clinical setting. So I want to describe that to you, how I deliver it, and why each step is actually quite important. So the first step is always the patient assessment, and this begins with an interview of the patient's desires, their wishes, and their primary concerns. This step is really important because if you're not sure exactly what the patient is bothered by and really have a fine-grained analysis of that, then it's unlikely that you're going to deliver treatment which addresses their concerns. In other words, you're going to have an unhappy patient who still has their primary concern. So finding out what the patient is actually concerned about is the key step in treatment planning. We then need to perform a systematic and consistent diagnostic process where we're assessing the patients from an extra-oral and intra-oral perspective. This allows us to form a summary of the patient, a diagnostic list, which we can use to determine if it's the right case for us to treat or not, and if it is, what the right treatment strategies are. Once you've identified that the patient is the right one for you, we've had a discussion about whether we're going to accept things as they are, we want to maybe camouflage the malocclusion and aim for optimal, or whether we just want to optimize the alignment of the teeth and just accept the other residual features of the malocclusion, we can have that conversation using that summary statement. We've collected the records using an intra-oral scanner, ideally. Excellent photographs are also a key part of this. Without those high quality images, it's hard for us to really demonstrate what the patient's occlusion was like at the beginning. You should try and capture the soft tissues as much as possible and not just focus on the teeth. So investing in high quality retractors, mirrors, and a good photography setup is really, really important. Otherwise, we're not going to be able to submit and create high quality records, and that is what our plan is going to be based on. The submission of aligner plans is relatively straightforward. They're all quite similar, and it depends on which provider you're using or if you're producing in-house aligners. It usually requires submission of the photographs, sometimes radiographs if you wish, and the STL file which contains the patient's intraoral scan. The process of delivering treatment really starts from here, and where you really earn your bread as an orthodontist or as a dentist providing orthodontic treatment is delivering the aligner treatment in a planned way. And the online simulation which you get back is that planned method. So we must be able to go through that simulation in a very systematic way and figure out if this is going to work or not. That involves figuring out if the teeth movements are biologically possible and also if they can be delivered reliably using your preferred technique, whether that's aligners or fixed braces or anything else. The process of going through the simulations can be quite time consuming, but it's worth spending that time to ensure that it is a realistic plan and one that you can deliver. It requires an understanding of the tooth mechanics, it requires an understanding of how the aligner plastic behaves, what attachments you need to use in which situation, and how to stage your treatment as well as the IPR. So we'll discuss that in time. We also need to think about, at the end of treatment, how we're going to keep the result that we've achieved. We don't just simply want the patient to walk out the door and have relapse, come back to see us in 3 months' time with a problem. So what kind of retainers are you going to plan? And you must plan those from day one, as it's too late to think about fixed retainers or bonded retainers at the end of treatment. You might not have the space to bond them onto the patient's teeth. So think about the retention from day one and ensure that you have a strategy from that as well. So that's really the patient journey, how I tend to approach it. I spend a huge amount of time on looking at the online simulations and ensuring that's optimized for the way that I deliver my care. And I hope you found this useful. Thanks.